very good evening all. I am Aditi Lamba with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. Globally, we are looking at more than 92.3 million cases of COVID-19 with nearly 2 million deaths. In the United States, we are at 23.1 million coronavirus cases with more than 385,000 deaths. Coronavirus deaths in the country hit another one-day high record at more than 4,300 deaths yesterday. The numbers are scary and alarming, and public health experts are now warning that even though vaccines are bringing a ray of hope, the nation is still facing challenging times ahead with record hospitalizations, overwhelmed system, and healthcare workers. Currently, more than 130,000 people are hospitalized with the virus in the U.S. The U.S. Centers for Disease Control and Prevention are forecasting another 92,000 deaths in the next 3 coming weeks. Quite a shocking and sobering number. We again want to assert here the importance of social distancing, washing hands, and most importantly, masking up. Meanwhile, in politics, a lot has happened. Yesterday, the House of Representatives voted to impeach President Donald Trump on charges of incitement of the pro-Trump mob, which rampaged the Capitol last week, killing 5, including a police officer. The country will be in uncharted territories when the U.S. Senate meets as soon as next week for the impeachment of President Trump, the first sitting U.S. president to be impeached twice and to face a trial by lawmakers after leaving his office. President-elect Joe Biden has urged Senate leaders to avoid a trial during his first days in the White House so they can focus on the economy, getting the coronavirus vaccine distribution back on track, and confirming crucial cabinet nominees. Also, the president-elect and his team are preparing for January 20th inauguration next week. This inauguration has been scaled back due to security reasons post the Capitol mob attack and COVID-19 pandemic, and the law enforcement are on high alert. Much is going on in the nation, so we have tonight several local officials, community leaders, commentators, and healthcare professionals. Here are the headlines. Dr. Rachana Kulkarni addresses COVID-19 surge and vaccine rollout, New Jersey. Political commentator Pallavi Purkayastha reacts to Capitol mob riots and Senate runoff, Georgia. Common Cause New York hosts virtual forum, ranked choice voting, and race for City Council District 24th, New York City. A lot more on the other side of break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lamba, and this is Vision of Asia, Thursday night episode of South Asian News. Last week, we saw a Democratic flip in the United States Senate, where the victories by Jon Ossoff and Reverend Raphael Warnock, both Democrats, solidified Georgia's political transformation and ensured that President-elect Joe Biden will have an easier time enacting his agenda. Their wins were overshadowed, unfortunately, by violence, which we witnessed when a mob of Trump supporters stormed the U.S. Capitol last week, where Congress was confirming Joe Biden's victory. Both of the 2 new senators are first Democrats elected to the Senate from Georgia in 20 years. Jon Ossoff is a documentary filmmaker and the youngest newly elected senator in the U.S. Senate, and Reverend Raphael Warnock is the first African-American Democratic senator from a former Confederate state. So what is the importance of Georgia turning blue in 2020 elections, and how are Republicans responding in the state? Discussing the impact of this Senate runoff, we have now another segment of our conversation with political strategist and commentator Pallavi Purkayastha on Georgia's politics and more. Here is Pallavi. Do you think communities of color are the biggest reason Georgia has been flipped?
Yes. It's a very short and sweet answer to that. Yes, I think we've done the work for years and years and years. And when I say we, I give so much credit to Stacey Abrams and just the infrastructure she put in, and the fact that she kept going even after Democrats kept losing. Because it's very easy to kind of look at it now and say, look, we won, this works. She was somebody who didn't falter. She didn't doubt herself, and she didn't doubt her strategy when we were losing, because she saw that the gaps were getting smaller and smaller. And I think when you invest in communities of color as Democrats, and not just during election day or during election week to get them out to vote, but make sure that when people are elected, that the policies that they're enacting, the policies that they're fighting for and fighting against, are with communities of color in mind. I think when people realize that they're really being thought about, by government entities, they're going to come out and vote because they feel like they're being heard. So I absolutely, hands down, think, I mean, there's no way you can look at who came out and voted, and you look at the numbers of Black voters, and you look at the numbers of Asian American voters. It's very hard to not understand that that is the one thing that, kind of took us over the line.
How has the response been towards both these candidates from the Republican side post the runoff?
A little bit of the same. I tweeted a little bit against Kelly Loeffler as well as David Perdue. Kelly Loeffler came out and she conceded, but then she said something along the lines of, we're going to still fight the radical left. And this was hours after the insurrection. And I think that could have been her moment to take down the temperature a little bit. And she still chose to demonize the left. David Perdue in his concession speech or written statement wrote something along the lines of, we won in November, but we couldn't win, which is a lie. He did not win in November. Nobody won in November, right. Which is why we had a runoff. I still think that they could have taken the moment and they could have shown grace. They could have told us, they could have led the way to show us that we could come together as a state, as just Americans, and they couldn't rise to it. So I think it's more of the same. And at this point, it's just about enacting good policy without really looking at what makes us look friendly or polite as a party.
Pallavi, when you look at both these campaigns that happened, and again, you have a lot of insight into it, how did their programs or the way they were functioning change right after the presidential elections when they knew they were about to go into this runoff? Were there strategies that were changed to make sure that most of Georgia that is voting blue continues to vote blue?
Absolutely. I think this is where the Democratic Party of Georgia did a really good job. There was a great coordinated campaign between the party and the two campaigns, the two Senate campaigns. We did have a third race on the ballot, but the two Senate campaigns as well as the party really coordinated things to make sure that we weren't kind of repeating efforts without having the right getting the right rewards for it. So when people were knocking at doors, they were knocking for all the candidates. When we were making phone calls, we were making phone calls for all the candidates. There was a really good just infrastructure to get all of these, both the campaigns to coordinate. And that allowed us in a short span of time, because runoff, you just simply don't have the kind of time that you do for a runoff with a general election. And with the fact that we have a pandemic going on, it really allowed us to make sure that we were hitting more doors and hitting more phones, and doing it in a timely fashion. So all credit to the Democratic Party of Georgia and their coordinated campaign on that.
Let's now take a look at coronavirus pandemics updates and measures. On vaccines, more than 30.6 million COVID-19 vaccines have been distributed across the nation, and more than 11.1 million Americans have received their first dose. Experts are encouraging states to open up eligibility to more groups to help speed up the vaccine rollout. This is by far one of the most ambitious mass immunization campaign in U.S. history. Strict rules putting healthcare workers first in line for the vaccination had slowed down the rollout process. So now states are urged to vaccinate anyone over the age of 65 as well. This move bumps up senior citizens, regardless of whether they have underlying medical conditions, to the top of the priority list for vaccine recipients, just behind frontline care workers and residents and staff of nursing homes. Health and Human Services Secretary Alex Azar said that the administration is releasing its full stockpile of 2 vaccines from Pfizer and Moderna. Also on vaccine, Johnson & Johnson said that the pharmaceutical company was on track to roll out a single-shot vaccine in March. Discussing this and much more, we have now our conversation with expert Dr. Rachana Kulkarni. Here is Dr. Rachana Kulkarni. And just talking more about the vaccine, I have to ask you, this new variant that we keep on hearing about in the news and how infectious it is, do you think it will be efficient, the vaccine will be efficient for it, or how are you looking at it, the entire thing?
Oh, there's so much about COVID that we don't know. So I think it's possible that all the strains, just like flu, this is just a kind of a very virulent flu is how I'm seeing it, because when influenza started, it killed so many people. with similar, viral transmission, more transmission in close quarters, then deteriorating to pneumonia and pulmonary infections, causing a lot of mortality. And that's what I'm seeing here with the COVID-19 virus. And just like flu, the strain mutates every year. The flu vaccine strain mutates, and I can foresee the same thing. But at this point, it seems that the Pfizer and Moderna vaccine, which are currently available, should be able to cover the new strains. But that's not to say that that will hold true in the future, because the virus mutates.
Yes, this is one mystery disease, I tell you. We're still figuring out and learning so much about it. How are you looking at testing and therapeutics?
Testing at this point, I think we are pretty good. Testing is widely available. Multiple different tests are available, the antigen, the PCR, the rapid PCR. So testing-wise, I think we are fine. Anyone who wants to get tested can get tested. The turnaround time is pretty efficient at this point.
Nice.
What was your second question, Aditi?
About therapeutics?
Therapeutics are pretty good. Like, I think we have gotten a good handle over how to treat, what to do, what not to do. So therapeutic wise, I think we are pretty good. The monoclonal antibody, the remdesivir, use of steroids in a timely fashion has been a very nice. We have a lot of good options and therapeutic options to treat it.
Do you think, and I just have 3 more questions left here for you, Dr. Kulkarni, do you think we'll be able to send students back to school this year?
I hope so. And that all depends on following the science, people taking 2 shots of vaccines in a timely fashion, and majority, like, I think for schools and all, it should be mandated that people should be able to return to school only after getting the correct dose of the 2 dosage of vaccines. I hope it is possible come fall. I certainly hope so.
But for kids that are younger than the age of 16 and 18, there is no vaccine right now for them. So what do you propose in that manner?
That you're absolutely right, Aditi. At this point, the Moderna vaccine is approved for people over 18 years, and the Pfizer vaccine for people over 16 years. We don't have studies for the vaccine in young kids or pregnant women. So that is that unknown part of what to do with the kids, because you don't want to do anything to the kids. First, do no harm is the mantra, and I don't think we have enough data on it.
Oh, wow. So we'll have to see what happens with children here, because, of course, they're not going to be vaccinated right now. Another question I have for you is, of course, our South Asian population is at high risk because of heart issues, lung issues, and diabetes. How are you looking at that right now? And how has your experience been, especially with your cardiac patients?
Sure. At this point, we are seeing like the second wave or the after effects of the first wave of COVID patients. So now most major institutes have started doing COVID recovery patients as outpatient, because people are now experiencing a lot of after effects of COVID infection. And as we know, COVID can pose challenges with the immune system as well as the clotting system. So a lot of people with thromboembolic events. So as a result of that, we now have implemented some kind of blood thinners for people who have had COVID infections.
Oh, wow. Quite a lot happening there. My final question to you, Dr. Kulkarni, has to be, I would love for you to give us a prediction for the next 2 months. What should we be preparing for? And, what are your hopes with the vaccine rollout?
My prediction is we will continue to see, unless people change their behavior, we will continue to see a very high number of deaths per day for at least for next few weeks. And once people start getting vaccinated, is only then it will, hopefully, the trend will go down. I certainly hope that the new administration keeps up its promise of 100 million vaccinations over the next 100 days, because that is what is going to take us through this. So I hope we all have a little bit more patience to help us see through this finish line, because that finish line is right in sight.
It's time for the short break on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lamba and this is Vision of Asia, South Asian News segment. Common Cause New York is leading the fight throughout New York State for open, honest, and accountable government that serves the public interest. Dedicated to empowering and protecting the voice of the people, Common Cause New York works with policymakers, organizers, and community leaders to build an inclusive and representative democracy where all have an equal say. On this and to raise awareness, recently Common Cause New York hosted a virtual forum on ranked choice voting and the race for City Council in New York City's District 24th in Queens. The forum was co-sponsored by Rank the Vote New York City, the Queens Daily Eagle, Disability Rights New York, and the Northeastern Queens chapter of the civil rights organization NAACP, the National Association for Advancement of Colored People. Attending the virtual event were New Yorkers, community leaders, and officials, along with 6 candidates running for the City Council seat in District 24th. The candidates were Momita Ahmed, Deepthi Sharma, Dilip Nath, Soma Syed, James Gennaro, and Dr. Neeta Jain. The team of ITV Gold was also present in support of this virtual forum where the candidates discussed the importance of ranked choice voting in boosting their campaign. Ranked choice voting allows voters to rank their top 5 candidates in order of preference. The election is taking place on February 2nd and polls will be open from 6 a.m. to 9 p.m. Here are some highlights from the virtual forum.
Begin this. A very good evening all. My name is Aditi Lamba and I'm a TV anchor and a content producer at ITV Gold based out of Astoria, New York. I host a daily show, a South Asian news segment called Vision of Asia. ITV Gold is the longest serving South Asian network in this nation, and we proudly represent the community voice through a variety of issues dealing with politics, medicine, culture, and much more. During this pandemic, we have continued to bring thought-provoking and knowledgeable news featuring elected officials, doctors, community activists, organizers, and many more. I'm super excited to be here at the forum today, and we hope that we are able to really promote ranked choice voting through this. Now I'd like to introduce my co-moderator for this evening, David Brandt from the Queens Daily Eagle.
Thank you, Aditi. My name is David Brand. I'm editor of the Queens Daily Eagle. We are Queens' only daily English language print paper, and you can find us at queenseagle.com. Follow us on Facebook and Twitter at Queens Eagle. I'm also the co-host of a weekly Sunday morning live news show on WBAI 99.5 FM called City Watch, which I host with my friend and partner Jeff Simmons, who is also from Queens. So this show definitely has a distinctive Queens flavor to it. So I encourage you to tune in every Sunday, 10 a.m. on 99.5 FM. Really excited to be participating in this forum. Kind of a historic moment. It's our first test of ranked choice voting. And so it's cool that it's happening in Queens. Thank you, Common Cause, for inviting us to participate.
Let's now go to Dr. Neeta Jain. What issue are you considering a little taboo that you have been able to talk about due to ranked choice voting?
All right. Very good question, first of all. And we all know what we are going through. So my issue is mental health, which is affecting every single age, not only in my district, but all over the world. And I'm sure that everybody agreed with that. School children are growing with anxiety, right? Our youths are out on the streets and they are doing more and more drug abuse. And our seniors are going through depression during this whole pandemic. So that is a very big challenge for us. Like physical health, you can get rid by taking medicine and taking therapy and this and that, right? But mental health is really suffering, and we have to pay attention to this. We have to make it most prioritized. So that is my main taboo and issue. And ranked choice voting definitely is a place where we can promote, where all other candidates can come together and agree to this issue, and this issue will be there forever. it's not going to go away that easily. So we really have to pay attention to this one.
Thank you. And let's go to DT Sharma. How do you think ranked choice voting can serve voters, and how is it affecting the way that you're campaigning and talking to voters?
Yeah, I think it's really important for voters because it's been said before, but I think that it's giving a chance for voters to actually research and look up every single candidate, because now that they know that they're not just voting for their number one, they're voting for number 2, 3, 4, 5 in one shot. It's been a great way for them to do the work, do the research, get more involved in local elections, and remember that local elections have a huge impact on their day-to-day lives. It's not just what they see on a national level or state level, that they have to focus on what's happening on a city level. So that's been really, really important, is to actually talk through why ranked choice voting is important. And, you know, when we're doing calls and someone says, I'm voting for so-and-so, we immediately talk to them about ranked choice voting, because we know that they just don't know enough about it. And that's where we educate them, like, hey, if you're not going to choose us as your number one, how about number 2? Here are some of the things that I am focused on. And again, like, we're not focused on talking them into voting for us as their number 1, but as their number 2, and talking about the important things that we feel are important to the district and the issues that matter the most. So for us, that's just what it's been, is making sure that we're approaching it with an educational standpoint, and, you know, getting as many votes as possible on all levels, not just the ones with the 2, 3, 4s, and 5s.
Let's now go to Mr. Jim Gennaro. Same question for you. How does RCV minimize the spoiler effect for your candidacy?
Yeah, I think that the whole idea of ranked choice voting is to turn the splitting, to turn that splitting phenomenon on its head. Somebody runs for office, and she or he has a certain band of supporters, and through ranked choice voting, people of a similar ethnic and racial group will combine votes to create essentially a possible super candidate, so to speak. So it really does turn it on its head. And so that is the good thing about it. I have to agree with Soma in that there has not been enough education by the Board of Elections and by the Campaign Finance Board about it. So this election is going to be a little bit of a shakeout. And if there were, more education, that would be better. Speaking for my campaign, I know all the campaigns probably do the same thing. When we're on the phone with people, we do our best to educate them of the reality of ranked choice voting and how it works. So we're kind of trying to do the job that should have been done in a much better fashion by the Board of Elections and by the Campaign Finance Board. But when elected, I'll make sure that I get that straightened out.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.